Hi, Dr. Woodland here. Did you know that there is a list out there of medications that are known to increase your risk of early dementia and death? Stick around and let's become more aware together. As our population continues to age, there's increasing worry among my patients about the possibility of developing dementia. And that's why I'm doing this video today, is to talk to you about these medications that can increase this risk. Now, dementia's impacts on the world definitely well felt. A couple of stats to share from the World Health Organization. So 55 million worldwide are impacted by dementia, have been diagnosed with dementia. This is the seventh leading cause of death. In 2019, the cost of dementia was $1.3 trillion, and this number is expected to rise as the years go on. We're 5 years past that now already. Women are impacted both indirectly and directly more by dementia. So the more women are diagnosed with dementia, and then also 70% of the caregivers of folks with dementia are women. And so women are disproportionately impacted by this disease. Now, there's also certain risk factors for dementia, including age, genetics, history of smoking or alcohol abuse, also poor diet, hypertension, diabetes, multiple sclerosis, HIV, other medical conditions, as well as a psychologist, this is an important one to me, is social isolation, and then low education as well. And then another risk factor that we're going to talk about is medications that you might be taking. The medications in question are what are called anticholinergic medications. So what these medications do is they block the release of acetylcholine in your brain. And what happens is that when you have what's called an anticholinergic cognitive burden, this increases the risk of dementia. And the higher the burden, the greater the risk of dementia. In circulation, there's a scale that measures the impact of the anticholinergic burden amongst a whole host of medications. And this is called the ACB Scale, or the Anticholinergic Cognitive Burden Scale. I know it's a lot to say. So, what is this? So it's the classification of drugs based on their potential negative impact on cognition, and separated into three categories. So the first category is medications that are possibly anticholinergic in their burden. And then there's definite anticholinergics in the second and the third category. The third category being the most impactful in terms of burden on your cognition. So how is this ACB scale used? So what you do is you add the score that is assigned to each medication in each scoring category. And each 1 point increase is associated with a 26% increase in the risk of death. And each definite anticholinergic on the list may increase the risk of cognitive impairment by 46% over 6 years. And so the idea is that the more anticholinergic medications that you have on board, that you're using on a daily, regular basis over time, are going to increase significantly, one by one, that risk of dementia. When we think about pain management as one of my areas, there are some medications that are included on this list. So in list number 1, we have Wellbutrin, we have codeine, fentanyl, morphine, and prednisone. I've seen these amongst my pain management patients. On list 2, we have Flexeril, we have Demerol, and we have Nefopam as well. And then on list 3, we have amitriptyline, imipramine, nortriptyline, and Norflex. In the sleep realm, we have some interesting ones. We have Xanax, Valium, and Haldol. Now, these are not sleeping pills per se, right? But they're ones that I see oftentimes being used, or in the past have been used, to help people calm down and sleep. This is again list one. Also on list one is trazodone. Okay, trazodone is probably the most commonly prescribed sleeping medication, in particular in primary care or by your general practitioner. On list two, there are no sleep medications. On list three, we see amitriptyline and nortriptyline. These were also listed in pain. Amitriptyline and nortriptyline are tricyclic antidepressants that have indications for both pain and also help people to feel drowsy, and they might use it for sleep. And then in the middle of this list, you have a couple of interesting over-the-counter medications. So you have diphenhydramine and doxylamine. So diphenhydramine, also known as Benadryl, doxylamine, also known as Unisom. These are two, again, over-the-counter, but are highly anticholinergic. Then we have hydroxyzine, which is another antihistamine, similar to diphenhydramine and doxylamine, but is typically prescribed. And then also last on this one that's highly anticholinergic on this list is Seroquel, which is an antipsychotic, which I have also seen used for sleep. So what does this mean for us as consumers of these products? So by the way, this is not medical advice I'm going to offer right now. I encourage you to talk to your doctor if you have any concerns about any medications you might be taking. Now, as along those lines, it's important that if you do find medications that you take on this list, that you speak to your doctor. Self-advocacy is important. It's important to ask questions, write them down. If you have questions about these or other medications on your medication list from your doctor, write down your questions specifically so that when you have the opportunity to speak to them, you'll be ready to ask questions and to generate a fruitful discussion. Some of the medications on this ACB scale can see less dependence with lifestyle modifications. And this is an area that I'm an expert in. Now for pain, this could involve, for example, neuroscience education or working with a physical therapist, learning how to properly scale your breath work, flexibility, mobility, your strength and balance. For sleep, it could also involve working with a clinician trained in cognitive behavior therapy for insomnia, also known as CBTI. The bottom line is that even though some of these lists out here and some of these medications can be cause for fear, there is hope. And with greater health and with greater engagement in your health, you can see improvement right now. You don't have to be at the behest of medications all the time, okay? You don't have to be at the behest of a treatment plan that maybe you weren't fully invested in. Talk to your doctor. Ask them about how to get off some of these medications if it's applicable and appropriate given your medical conditions. And seek out support from someone who has expertise in lifestyle modifications and lifestyle medicine as well. Thank you for watching. I'd encourage you to like, comment, subscribe if you'd like to see more of these videos and to learn more about how we can become more aware of the mind-body connection together. Take care.